When is an autistic child ready to start working on speech? The reason for this video stems from a small survey I conducted where many of you said we can start working on speech with a non-speaking or minimally verbal child when the child imitates. This is a very common belief, widely held. When a child imitates or makes eye contact, it's not actually the case. Why isn't it so? Often, if a child remains nonverbal for 3 to 3.5 years or longer, or if their speech is largely unintelligible, there are underlying motor programming issues. The brain struggles to plan and execute movements for verbal articulation. If I don't have difficulties, how do I learn? I watch how mom and dad's mouths move. I observe, listen, record, and mimic the movement. But if my brain has a motor planning issue, it sees but can't copy. So we find kids who open their mouths but no sound comes out, or children who don't know how to even begin, or kids making unclear sounds, sometimes called jargon speech, which is a series of sounds that seem like made-up language. Motor planning issues or apraxia can seriously affect speech. Verbal apraxia affects over 60% of autistic people at various levels. It's reasonable to assume that significant language development issues may stem from motor programming problems or apraxia of speech. Why isn't working on imitation or requesting eye contact appropriate in this case? With a motor programming issue, I can't learn through imitation. My brain doesn't work that way. It can't watch and repeat. So what should we do? Should we stop obsessively requesting eye contact? Should we abandon the idea that imitation skills will emerge just because we demand them? Imitate, 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 because this approach is much more challenging. Let's set this aside and approach it through a different channel. So we combine visual and auditory inputs autistic children don't struggle with, tactile inputs. We use methods that physically move the mouth, lips, and tongue of the child, teaching the brain which movements it needs to make to produce coded sounds and therefore speak. We completely flip the perspective. Among the most effective methods I use, we have, for example, the prompt method. I'll demonstrate the prompt method using a puppet in place of a real patient. It maps on the patient's face the movements the brain must make to program and execute speech. So, mom, dad, give me. So the brain records, I move you, show you, produce, speak, make you feel, and move you. I move you, and your brain records once, twice, 100 times until it can independently reproduce these movements. Option 2, oral motor therapy, helps achieve sufficient muscle resistance to support articulatory movement, and it can also work in other ways. Oral motor therapy uses many tools. I'll show you just a few now, but it can also be used to help establish these articulatory movements. So, for example, shall we say bubbles? Another option is vibration therapy, okay? I touch specific points with vibration to help feel where to articulate for certain movements and sounds. Is this type of treatment always successful? Clearly not always, but in many cases, yes. The child's verbal language unlocks, starting with words, phrases, and responses to questions. In most cases, we can at least establish basic words, but sometimes this approach doesn't work. If it doesn't work, we reassess and provide alternative communication methods like visual aids or gestures. Meanwhile, we've been working on mouth movements, improving the oral situation, so to speak, and recondition the brain. We've laid the groundwork and continue working, maintaining the harmony we've achieved while periodically reassessing the child's situation and trying again when we see the right conditions. We never give up, we always keep trying. So remember, in cases of non-verbal or highly unclear speech, waiting isn't the right approach. These issues stem from specific difficulties. We must address those to help our child or teen. If you enjoyed this video, please like it and see you in the next one.